For the exam, you want to remember a concept of ABGs, or arterial blood gases. When you get questions such as, is the client suffering from metabolic acidosis or metabolic alkalosis, or respiratory acidosis or respiratory alkalosis, you want to remember some basic concepts. Specifically, you want to remember the normal ranges of pH. pH, of course, is between 7.35 and 7.45. CO2 numbers range between 35 to 45, and bicarbonate numbers, or HCO3 numbers, between 22 to 26. These are all normal values. If the pH is less than 7.35, such as a value of 7.32, then this represents acidosis. When you're taking a look at CO2 values, such as a high value, such as 57, 57 is greater than 45, then that represents respiratory acidosis. It's respiratory because CO2 is regulated by the lungs. Let's take a look at bicarbonate values. The normal range is between 22 to 26. A value of 26 is a normal value. You want to remember that bicarbonate levels are regulated by the kidneys and/or the pancreas. Here's a typical type of question dealing with acid-base balance, or determining whether a client is suffering from respiratory acidosis or metabolic acidosis. This is Mr. Denson. He is admitted to the hospital. His ABG numbers are as follows: pH 72, carbon dioxide 57, bicarbonate numbers 26. The nurse would interpret these ABG values as indicating 1, 2, 3, or 4, metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. In order to figure this out, we'll look at the pH. The pH value actually gives us the answer. The pH in this case is 7.32. 7.32 is less than 7.35. Therefore, the answer must be acidosis. How do we determine whether it is respiratory acidosis or metabolic acidosis? We can look at CO2 values. The CO2 value is 57. 57 is greater than 45. Therefore, this causes acidosis. The bicarbonate levels of 26 is within the normal range. The answer is 3, respiratory acidosis, because the pH gave us the answer of acidosis and the carbon dioxide value was too high. Therefore, it is respiratory acidosis.